Good morning and welcome to COVID-19 Talk with Local Health Authorities. With me is Dr. David Persse representing the City of Houston and Dr. Umair Shah representing Harris County. I want to thank you to the Rotary Club of Houston for sponsoring this COVID Talk with Local Health Authorities. And I am Stephen Williams, Director, Houston Health Department. Let's get to it. Research from last week. JAMA mentioned COVID-related skin manifestations, rashes, and COVID fingers and toes could be the only sign a person shows. Have you seen this as a first symptom?
Yeah.
We have talked about this.
Yeah, we did. And we were going to go do some homework, and I didn't do my homework on that one.
So what I did a little tangential, and what I would say is that it can be a first sign, but the problem is that at times that you are not able to distinguish this from other kinds of rashes or skin disease, so it becomes harder to actually say, this is COVID-19. And so obviously the diagnostic is still getting a test. PCR test is the diagnostic. It really helps a clinician potentially make a decision, should I test somebody? It may also help an individual be more likely to go be seen by a clinician. The problem is that it could still mimic other kinds of skin conditions, so it becomes harder then to make that decision.
So you did do your homework.
I sometimes try. Dr. Persse is always a higher level, so I'm trying to figure out how to get to.
Yeah, we're flunking today. Okay, regarding school team sports, what safety preparation should parents and schools take? You know, I've been passing a lot of fields where there's soccer and everything else going on.
Well, David, I'm going to defer to you on this one, but I'll just start by saying one important, maybe global comment, which is that whatever is happening with schools, I think the first and foremost thing we want to make sure that parents are doing is to have conversations with their children. That is a key message. Conversations with their children, model the behaviors at home that you are wanting your kids to follow, right? So wear your masks, watch your distance, wash your hands, all those things, so that when your kids are now away from you in, whether it's a group setting, a sports setting, or an educational setting, or just at a grocery store, they're also modeling those behaviors because they're listening to you. So that conversation, I think, is a key component, and then I'll turn it to you.
Yeah, so for high school sports, I mean, it's a risky activity, unless you're playing tennis or something where you're physically distant, but whether it be volleyball, football, basketball, any of those sports, they're contact, you're huffing, you're puffing, you're breathing hard. I mean, this is exactly the sort of thing that the virus takes advantage of when it spreads from person to person. So probably the best thing that we can do is, do everything we can to keep the prevalence of the virus down across the entire community. You want your kids to play football? Wear a mask when you go to a restaurant. Or don't go to a restaurant. You want your kids to play volleyball? Then wear a mask and social distance, and be careful when you go to the grocery store.
But it is risky.
Yeah, it absolutely is. Yeah.
Yep.
A nasal swab test punctured a woman's brain lining. For those who have had sinus issues, would the swab and the mouth test be the only safe choice? That was an accident. Go ahead. Yeah, of the millions and millions of nasal swab tests, that's the only one that, everybody, if anybody's had it, everybody who has had it understands, yes, it's uncomfortable. But to have an actual injury, like in that one case that we know of, then that's a rare one-off. But, so depending on and the other thing is there's lots of other tests out there, right? And when you go and you get an oral test, some of those are antibody tests, which is completely different. Some of those are antigen tests, which is also different. And so it's not just where the swab goes, it's the actual test that's performed that you have to be aware of. So if the PCR test is still the gold standard. Buyer beware.
That's right. So just add to that is my one of my good colleagues is Dr. Pasha, Dr. Reza Pasha, who's an ENT surgeon here in town. He's fantastic, and he and I had this conversation actually recently. He said, look, it's really important that people are careful how they do these nasopharyngeal testing, the swabs, but at the same time, the balance is you want to get a good swab, and you don't want it to be that you don't go high enough or do enough of that, the swabbing, so you don't get good samples, so then you get a false negative. And so this is one of the real challenges. But I do think, David, to your point, is that there are other ways of going about doing this. But right now, the key is do it well, and it's rare that that happens, and it's more of a user error, if you will, if they went that far up.
Okay. Hobby School of Public Affairs survey found more women disproportionately reported an increase in anxiety levels. Are you seeing this being caused by juggling homeschool and working essential jobs or something else? You got to put on your psychology hats, huh?
Yeah. So I've not seen any specific research into that, but I mean the theories postulated there sound like a good place to start digging and looking. I don't know. Do you know anything?
This is probably one of those where I'll let you do the research this time around.
I think we can safely say that there is an increase in anxiety levels from our reports that I've been seeing.
Yeah.
I mean, with anything, when you're challenged with the change, having to work, having to go through virtual school with your kids.
Yep. And let's face it, in this society, the moms tend to be the more active child care person, and with whatever they would normally doing, plus now the virtual home. I mean, it makes perfect sense that there be increased workload and therefore stress on the moms.
Well, it's been a struggle. I'll tell you, I came home yesterday. My wife, who she has a clinical practice, and she tries to do what she can when she has time off, and obviously be at the house. She was at the house yesterday, and she was pulling her hair out because all day she was doing virtual schooling and this thing, that thing. We also have a 3-year-old. She's trying to figure that out, and then she's got patients calling, all sorts of things that were happening. So I think it does contribute, Stephen, exactly what you're saying, which is it's a very difficult time for parents who are having to now manage and juggle now new efforts with school.
Okay, in less than a minute, are people responding to contact tracers' requests for information, or are they refusing to share?
I think it's both. I mean, you obviously have those that are more likely to help and be willing. It's also some that are saying, hey, I'm not going to help you. The best thing that we need is that when people are diagnosed as a case, please let the people around you know that you might get contacted by a contact tracer.
Thank you for joining us with COVID Talk with local health authorities. We'll be right back.
Wash your hands. Scrub it while you sing this song.
I thought that was the last question. That's why I went longer. I was like,
Using soap and water means your hands so clean. Wash your hands. Great job, you're almost done. 5, 4, 3, 2, 1, now dry.
Wash your hands for 20 seconds, just like Elmo.
There are everyday actions to help prevent the spread of respiratory diseases. Wash your hands. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Stay home when you are sick. Cover your cough or sneeze. Clean and disinfect frequently touched objects with household cleaning spray. For more information, visit cdc.gov/COVID-19. This message brought to you by the National Association of Broadcasters and this station.
Respond to the upcoming 2020 Census survey online, by phone, or by mail. A complete count of all Houstonians helps our city secure federal dollars for roads, schools, healthcare, housing, and disaster recovery. By answering just 9 questions, your voice will help shape how Houston is represented by state and federal officials over the next 10 years. The census is easy and everyone counts. Your responses are safe and confidential. For more information, please visit 2020census.gov.
You have to stay home.
Not just to protect yourself, but to protect others.
Stay at least 6 feet away from other people. 2, arm's length. Just because you're at home
doesn't mean that we can't be alone together.
Have questions about the coronavirus?
I'm here to share some simple steps you can take to help protect yourself and others.
Avoid touching your eyes, nose, and mouth. Wash your hands often with soap and water for 20+ seconds.
Cover your cough or sneeze with a tissue.
Clean and disinfect surfaces and objects. Wash hands after touching commonly used items.
Together, we can help slow the spread.
Welcome back to COVID-19 Talk with local health authorities. Some people seem to rely on testing and take no preventative precautions. Others with obvious symptoms do not bother to get tested. Is testing continuing to decrease for those who are positive and increase for those who are negative?
So, yeah, so that's
I kind of lost a little bit of that in the middle of that, but David, you probably...
Well, I was going to say, you know, it's not like the, so we have no control over who goes to get tested. We encourage everyone to go and get tested, especially if you're symptomatic to go get tested, right? So we've seen the testing numbers over the past several weeks coming down, and right now it looks like they might start to be trickling back up again, which is a good thing. But again, the recommendation is, if you think you've been exposed to somebody, so if you're a close contact of a known case or somebody symptomatic, or if you think you have it yourself for whatever reason, you should go and get tested. We also recognize that 40% of the people who are infected have no symptoms, so everybody should consider going and getting tested. Because should you surprisingly come out positive, now you have the ability to know to protect your family members by isolating or actually quarantining yourself so you don't infect them. But you're not going to know. 40% of the people who are infected have no idea, so you're not going to know unless you get tested.
Okay. This is a personal comment. Last Friday, my husband and I were tested at Minute Maid. It was fast and easy, actually very empty. Staff was professional and safe. Results came back in less than 48 hours. Thank you.
That's great.
Yeah, I've been tested there twice, and they do a great job over there.
And I will say that, that is we've said this a few times, but let's just reemphasize that the image of I go to a test site, I'm going to be there for a long period of time, it's going to be 15 days before I get a result, that's of the past. You get there, it's a very quick process, it's very professional, very customer service friendly, and you'll get your results back quick within a day or two, which is really markedly different than before.
Yeah, we the health department, we may not get your test result for a week or more, but
but you'll get your test results back, right?
Yeah. Okay, Halloween. There are still questions about this. What specifically would you recommend? We all read the Twitter guidelines for the general public, but what do you think high-risk people should do to protect themselves and others? Stay home?
Well, so the very end was the really important part. What do high-risk individuals do? So I think we've been saying this throughout, is that know your own risk profile. If you're a high-risk individual, then I would say, Stephen, you hit it right there. Stay home, do not partake in those activities. That means two things. One, don't have all those parties. Stay home, but don't have all those parties where people are coming into your home. And number two is, when people are coming to your home for trick-or-treating, this may be the day where you keep that light off and you actually don't, or you have everything outside and you don't have interaction with them at all. Now, there are other specific guidelines related to trick-or-treaters, and our recommendation is that we want it to be safe. And the biggest concern we have is really mostly about those parties that accompany Halloween and people come together. But even we have to remind people that a mask that a kid puts on is not the same as a face mask that protects you from COVID-19. Yeah. And so we do need, and there's some specific things at both health department websites that you can go to.
Yep.
To return to work or school, you're supposed to be fever-free for 24 hours. Do you also have to be off all meds like those used for COVID that could possibly reduce fevers?
Yeah, no fever-reducing agents. So. That's right. Any medications you would be on that would be a fever reducer, whether prescribed by your doctor or not, and most of them are actually over the counter, right. You have to be off those and without fever for 24 hours. And have improving symptoms.
That's right. Yeah.
If it is true that some patients can deteriorate 1 week after their illness begins, should someone already sick enough to be hospitalized remain there for at least a week?
That's two different questions. So whether or not somebody remains hospitalized really has to do with what their clinical situation is at the time. Mm-hmm. So the timeline on the illness is not what determines. So if somebody's healthy enough to go home and they have a safe home to go to, then they should go home, with the advisement about, your symptoms may change. Because we have seen, and the stem of that question really was that, people get infected, they can get hospitalized, they can improve, and then they can deteriorate again. And we've seen that many times. Mm-hmm. So.
It seems like it's business as usual in the restaurants and retail around Houston. As long as we're wearing masks, is it okay to go about doing what we usually do, or should we still stay home and limit contact with others as much as possible?
Yeah, I'm going to jump on that one a little, if you don't mind, because this is a little bit of a pet peeve of mine. So, so if you're concerned and you go to a restaurant and you don't like what you see, don't go in. Right. So one of the things that I've come across from reports and actually from personal experience is that some of the restaurants, now it's up to 75%. So some of those restaurant owners, what they're doing is they're operating 75% of their restaurant, of their floor plan, at 100% occupancy and leaving 25% without any servers in it. That is completely...
That's not what it was meant to be.
It's a complete opposite. I mean, I don't know what they're thinking, right? Mm-hmm. So, you know, and the other thing is the governor went to the 75%, you know, sort of that's what he thinks is kind of going on, and that's great, but he doesn't think for you. You need to think for yourself.
Basically, it's about social distancing too.
Right, and if you're right, absolutely.
And we do, I mean, we are still saying that, look, if you can limit your interactions staying at home as much as possible, that is still a strategy that helps reduce your risk.
Mm-hmm. For a gathering to be defined as a super spreading event, does there need to be a positive case in 48 hours or a certain number of positive cases later than that?
Actually, I have done some homework on this one. Okay. So there is no really good definition of a super spreader event. Yeah. And if you look it up, because I've had to recently, if you look it up, you'll find, there's a variety of them, and they're almost like impossible to calculate. Mm-hmm. So one of them I looked at suggests that you have to get the R value for the event. Now, how in the world do you get the R value for the event? And then it has to be greater than some percentile of all events of the same size. I mean, so there's no good definition of a super spreader event, but it's and not only that, but you'll only recognize it in retrospect. So the event occurs, and then days later, if a bunch of cases pop up and they call it epi-linked to that event, then it may be labeled a super spreader event.
Yep. So it's after the event. Can you confirm that COVID infection is most infectious for a relatively short period of time, like 3 to 4 days, starting one day before symptoms onset or roughly 4 days after exposure?
Okay, so 1 to 2 days prior to somebody having symptoms, they can be what we call pre-symptomatic. We do say if you've been exposed to somebody with COVID-19 that it takes generally 3 to 5 days, 5 to 7 days. It's 5 days is really the sweet spot of the bat of when you should actually get tested, because that's the most likelihood that your test is going to be the most accurate, especially the PCR test. So there are some of those nuances. So the question has kind of conflated a few of those together. But I think the key message is pre-symptomatic, you can have symptoms and no symptoms, and you can still spread the infection. And if you've been exposed, it's about 5 days later that you should get tested. I think those are the key.
Yeah, I would say it's at least 5 days later.
At least 5 days, yeah. 5 to 7 is usually, yeah, that's right.
Okay, bars might start opening. Is there any way a conscientious person can go and be safe?
You know, right now I would say that to me, I really can't say there is. I mean, at this point, because there are a lot of reasons. Bars are indoor. You know, you tend to have people that, by the way, are leaning together. They're in close contact. You've got you know, the whole situation where somebody might be yelling or singing. You might have music that's loud, so you lean into each other, and you put that all together, and you've got, you know, ventilation because it's indoor as well, and that's the perfect recipe for real concern for infection. So I would not say at this point that bars are ready. Now, whether some bars can surprise or the state has some surprise, I don't know, but I can't figure out a way to make it safe across the board.
Well, I guess it's hard to wear a mask while you're drinking.
Well, that is true too.
And alcohol is a frontal lobe depressant, and there's where all your social inhibitions lie. So you get rid of your social inhibitions, you start behaving dangerously.
Shame on you. Thank you for joining us for COVID-19 Talk with Local Health Authorities, sponsored by the Rotary Club of Houston. We'll be right back.
Respond to the upcoming 2020 Census Survey online, by phone, or by mail. A complete count of all Houstonians helps our city secure federal dollars for roads, schools, healthcare, housing, and disaster recovery. By answering just 9 questions, your voice will help shape how Houston is represented by state and federal officials over the next 10 years. The census is easy and everyone counts. Your responses are safe and confidential. For more information, please visit 2020census.gov.
With coronavirus spreading, people at higher risk must take extra precautions. You're at higher risk if you're over 65 or if you have an underlying medical condition, please visit coronavirus.gov for more information.
Wash hands now. Wash hands now. Wash hands now. Wash hands now.
Hand washing is one of the best ways to stay healthy all year long.
My grandma always says everyone counts, and everyone who lives with us is special. Like my aunt, who took me on my first bus ride to the library, or my older cousin, who walked me to my first day of school, even my mom's friend and her baby who live with us.
The census informs funding for schools, roads, healthcare, and more. So count everyone in your home, including all children on the 2020 census. It's your chance to help them for the next 10 years. You can respond online, by phone, or by mail. Shape your future. Start here. Learn more at 2020census.gov.
Welcome back to COVID-19 Talk with local health authorities. Now we're getting to the heart of what people really want to talk about. This past week, a senior government official received an emergency use of antibiotic cocktails. Can you discuss the use of remdesivir along with this cocktail? Why take all these together? Is that the go-to for all of us run-of-the-mill people? And then the second part of that, if you're taking meds like dexamethasone, should you be in the hospital on a ventilator?
So let me kick it off, and David, I'll kind of put it over. So first of all, this is referring most likely to the President of the United States. So I think let's be very clear that we know that the President was admitted to Walter Reed Hospital, and a variety of medications were delivered. We don't have all the details of dosing and when and why. There were some information gaps that, I'll put that in a kind word, that we don't know all the information. But from what we know, it is true that depending on the clinical scenario, physicians, the healthcare providers may make decisions on the kinds of medications that they would give. Now, there's a whole host of those. It can include antivirals like remdesivir. It can also include IV dexamethasone, which is an IV steroid. It can include a lot of other things, everything from supplements and vitamins and things of that nature, plus supportive therapy like oxygen and IV fluids. The key is that we can speculate a lot, but we really don't know specifically. It's the doctor, the healthcare team, and the patient that actually knows specifically what was going on in that clinical scenario. So, David?
Answer the loaded question, David, at the end.
Yeah. So, it's a difficult question. I think that, there's a lot of speculation that the president was treated aggressively, and the speculation is that he was treated more aggressively than the average person would have been. And because of exactly what Dr. Shah said, we weren't there, we don't know the specifics of it. That's really none of our business between those two. I would say that as a healthcare field, we are learning an awful lot, and I don't think that there's any physician in the United States who's not being aggressive with their patients who are hospitalized with COVID disease. And I don't think you can equate the two. I think that you need to trust your doctors. Go to a hospital that you trust, with a doctor that you trust, and be as aggressive as that physician thinks is appropriate. Because here's the thing: there are downsides to being too aggressive.
That's right. Yeah.
So we may. There are people who are seeing the president, there's a risk with being too aggressive. So we are assuming, we would like to believe that the president's doctor's team and the president, they took appropriate risks, right? And if you think that they took an inappropriate risk or they were too aggressive or whatever, that's for them. You can't equate your situation with his.
Okay. A new trial is scheduled to start monthly from July to November with 30,000 people in each. This is amazing. I read that trials normally only need 15,000 for efficacy. To get through a trial is the goal to find 150 cases? I'm not so sure what that means.
I'm not sure I understand that one either.
I'm not sure I understand it. Well, so in a global sense, when it comes to doing trials, there are smaller trials that are done first. And they're kind of like pilot tests, right? Yeah. And from that, you can then calculate the size of the population you need in order to get the power in the study to really get your answer. So there 15,000 may be a good number based on what the preliminary, the small group showed, or may need to be 30,000, or may need to be 100,000. So from one study to the next, the target population will vary.
If I have asthma, should I go to work?
If you have asthma, should you go to work? So, again, we're in general, you can go to work, but you have to be very careful around work. And the reason is asthma is one of those underlying conditions that can give you complications. So you got to wear the mask. You got to social distance. You got to make sure you're away from others. You got to make sure you're understanding what all is in play there. If you feel that is safe and comfortable and you can do all those things, then yeah, I think if you have asthma, you can. But if you are concerned, or if you're somebody who your doctor has told you need to curtail your activities because your asthma is so bad, or I'm so concerned, then maybe you should be staying home. So it just depends.
Okay. If you become extremely ill and there's a particular drug that could be used for emergency use only, should you be hospitalized to receive it? I guess the risk.
So if you're sick enough to require hospitalization, then you should be hospitalized. Now, whether, and this is probably a question about the president, but there are other folks who've gotten experimental therapies who didn't require hospitalization. So it's two different questions.
Is there such a thing as being overtreated?
Oh, absolutely.
Yeah, absolutely.
Yeah, absolutely, yeah.
There's also something called undertreated. So, this is the balance. This is what we talk about, the science of medicine, the art of medicine. This is also the science of public health, the art of public health. There is this sweet spot of the bat. If you are undertreating somebody or overtreating somebody, those are both have consequences.
Okay, the chief advisor for Operation Warp Speed mentioned that there would not be a life-replicating vaccine until 2020. What is that?
2021 or 2020?
Well, this says 2020, so I'm going
with
what
replicating?
A life-replicating vaccine until 2020. What's a life-replicating vaccine?
I'm not sure I've heard that term.
I'm not sure I know that term, yeah.
We do know that, obviously vaccine, there are essentially 5 candidates that are out there, actually 6. Six candidates. 5, we believe, require 2 doses. One is a 1 dose. They're really in the phase 3 trials, and it looks like there's not going to be a lot of vaccine that's available this year, but we're looking at what that's going to look like for next year.
If you're in a clinical trial and don't know if you're receiving a placebo or the real thing, and then come down with COVID, can you be told what you received?
It depends on the trial.
Depends on the trial, yeah. It depends on the specifics of the trial.
If a person already had COVID and recovered, should they get the vaccine when available?
So probably yes, because what we are coming to learn is that your own inherent immunity that you develop after the illness it seems to be short-lived.
Yeah,
like it may only be a couple months, and not everybody who got COVID, they may not have any immunity at all. So.
That's right.
Do you know if pharmaceutical companies can be given immunity from harm due to quickly created vaccines?
I don't know that.
We don't know the answer. The emergency use authorization bar is lower than regular. The FDA medium is 2 months. Follow-up time for safety. Most adverse events occur within 2 to 3 months. Is that follow-up period what is being cut to speed up a vaccine to market?
Well, I think what we're seeing is that the good news is that FDA has actually asked for 2 months of safety data, and we're going to wait to see what that shows. But that's exactly
to answer
what
the
we're
question,
looking at.
what's rushing this through is not cutting that. It's advances in technology have let the first part of vaccine development get much, much shorter.
Yep.
At the end of 2020, only 20% of the world will be vaccinated. People seem to be tuning out because of frustration. Should I even consider getting a vaccine when it comes out?
Absolutely.
Yeah, absolutely.
Yeah,
you should
absolutely.
consider. Yeah, absolutely. And what I would say is that if the health authorities, the health folks say it's safe, it's effective, get your vaccine, that's when you should get your vaccine.
Right.
Thank you for joining us for COVID Talk with local health authorities. With me was Dr. David Persse representing the City of Houston, Dr. Umair Shah representing Harris County. Thank you to the Rotary Club of Houston for sponsoring this event, and I am Stephen Williams, Director of the Houston Health Department. See you next week.